Okay, so this is the conclusion of the endocrine system notes that we didn't quite get to in class, and this is really just going to look at a couple of specific examples that we see in the human body. The first example is the endocrine pancreas, which is completely functional to help control the level of glucose in your blood. Now, notice here that this means the blood glucose level. So not the glucose that's in like your cells and your tissues, but actually the sugar level as it is floating around dissolved in your bloodstream. Now, on a normal kind of basis, that should be 70 to 110 milligrams of glucose per 100 milliliters of blood. So if you test your glucose, it should be somewhere in that 70 to 110 range as sort of a resting blood glucose, so meaning you haven't eaten real recently. Now, we have to keep it near this norm, so part of homeostasis is to have that sugar level at around 70 to 110. And so what the pancreas does is it releases two antagonistic hormones, right? Two hormones that have opposite functions that will both work in a simple endocrine pathway, like we saw at the end of class, so a very just straightforward hormone to a target tissue, and it will involve some negative feedback. The first hormone that we want to look at then is called insulin, and I'm sure you've heard of that one before, and we've mentioned it in class. Insulin's job is to lower blood glucose levels, so it's going to lower the amount of sugar that's dissolved in your blood. The way that it will do that is to send that glucose out of your bloodstream and sort of pack it away in your cells instead. So we need to make the tissues absorb the glucose to lower the amount of glucose that's in your blood floating around. This is released by beta cells of the pancreas, and the beta cells are found in these little tissue areas called islets of Langerhans, which is just a fun name. But you can notice here that tissue looks a little different than the rest of the pancreas. So these beta cells will release insulin when blood glucose is high. So after you eat, your blood glucose is going to increase, and your pancreas is going to release insulin. Insulin will go to receptors on lots of different tissues in your body, and on all those tissues, it's going to have those tissues uptake or absorb glucose. And this is especially true of your muscles and of your liver. So those tissues will absorb glucose, and that'll get it out of your bloodstream. Now, insulin's secondary function will also slow the breakdown of glycogen in the liver. So it'll slow your body from freeing glucose into your bloodstream, which it would need to do if you hadn't just eaten. So it's going to slow the body's kind of increase of glucose, and while also reducing the amount of glucose that's in your bloodstream, like right after you eat. Opposite hormone is called glucagon. And notice how similar this is to glycogen and glucose and stuff. So glucagon is the antagonistic hormone that also comes from the islets of Langerhans that will raise your blood glucose. Now this is released by alpha cells. So insulin comes from beta cells, glucagon comes from alpha cells in the pancreas. And this will happen when blood glucose levels are low. So when you haven't eaten for a while. So when you are fasting, your blood sugar gets low, and your body needs to stimulate some processes that will get that blood sugar back up to where it should be. So the primary stimulus here is it's going to increase the breakdown of glycogen storage in your liver and your muscles to release glucose out into your blood that you can use. This will also increase conversion of fats in your body and proteins in your body into glucose, like we learned about back with metabolism. So, what we are looking at then as a whole, if you eat, that's going to increase your glucose, and insulin will counteract that and cause a decrease. If you haven't eaten for a while, so we'll say you're starving, it doesn't have to be that extreme though, it's just like it's lunchtime and you're not eating yet and you're getting hungry. That means that you've got a decreased level of glucose, so glucagon will be released and will increase those blood glucose levels. So the whole goal is to keep glucose levels at that kind of homeostatic level. Now here's a nice little picture of this going on. So our stimulus, if blood glucose level is high because you just ate, then the pancreas will release insulin. Insulin will cause a reduction in glucose levels back to homeostasis. If it has been a while since you've eaten, you get the opposite response. So the pancreas releases glucagon. This causes blood glucose levels to rise back up to the homeostatic level. Now, diabetes is a very common illness, and when we talk about that, sorry, lunch bell. When we talk about diabetes, there's actually a couple different types, and the diabetes that we're all most familiar with is what's called diabetes mellitus, and this means that you have a deficiency in insulin or a decreased response to insulin by your tissues. So either you don't have enough insulin or your tissues are ignoring insulin. This leaves high blood sugar levels, right? So insulin will usually reduce your blood sugar. If you don't have insulin, that doesn't happen and you have these high sugar levels. This can be damaging to cells. High levels of sugar can cause membrane problems. This is particularly damaging to neurons, and over time you can see some bad effects in people. This high sugar level also kind of overwhelms your kidneys, who will usually filter that out into your urine. So it sees so much sugar coming back from the bloodstream that it's going to increase the amount of glucose that you excrete. And when you, if you think about cellular mechanics, again, you think about moving things across the membrane. If we move glucose out of the cells, water will follow solutes, right? So water follows those cells too. You excrete more water and you get increased urination. So that's one of the signs and symptoms of diabetes. That takes us back then to the interesting naming of this. Diabetes mellitus comes from two Greek words. The first one I don't really know how to say, which is diabeinin or something like that, which is to pass through, and meli means honey. So basically to pass through, more stuff passing through your kidneys, more urine, and the urine of someone who has diabetes is a little bit thicker usually and very dark and almost has a honey-like appearance. Now, it's not that thick and it's not that dark, but it kind of is where they got that name from. Now, no insulin also means decreased glucose uptake by cells. So when they don't get glucose, all your cells, they'll start to burn fats as their major metabolic fuel. And the reason this can become really scary is that those fats, when they break down, will form a somewhat acidic byproduct called ketones. And if that would happen over time, for a long period of time, you can get a little bit of an acidic quality to your blood, which can actually cause organ shutdown and death. So diabetes can be very serious. There's two types of diabetes. Type 1 diabetes is sometimes called insulin dependent. It is totally genetic, and it is where your immune system destroys the beta cells of your pancreas. So this is, as mentioned previously, an autoimmune disease. Now, because it takes a while for all the B cells or beta cells to get destroyed, you usually don't see signs of type 1 diabetes until maybe the teenage years. But it is because the body's kind of destroying its own pancreas. These people don't make enough insulin, so there's no cure because it's genetic, but if you give them insulin, a lot of times today, these people wear a pump of insulin that is delivered at a certain rate, then they can live a pretty normal life. This is usually diagnosed in childhood, but like I said, it might be teenage years before you see the symptoms. And these people are usually very thin in body type. And they include some famous ones. Halle Berry has type 1 diabetes, and this Jonas kid. I don't know which one it is, but this Jonas kid is also type 1 diabetic. Now, type 2 diabetic is a lot more common in the United States. This is called non-insulin dependent. And this is where you have plenty of insulin, but your tissues start to ignore it, basically, and do not take up the sugars like they're supposed to. This happens as a response to obesity and lack of exercise. And so this is something that's usually seen in older people, usually more than 40 years of age, and is seen in obese people with poor diets and poor exercise habits. Paula Deen, hate to pick on her, but if you've seen her cooking shows and you know how much butter she uses, then you understand why she might be type 2 diabetic, which she is. This is actually 90% of diabetes in America, so most of it is not genetic, but it's due to this poor dieting. Scary part, used to only see type 2 diabetes in older people like this. Now you're seeing type 2 diabetes in kids as young as 12 or 13 years old because we play video games and we eat bad, so it's really important to avoid that. Good thing about this is type 2 diabetes is reversible or is curable. If you improve your diet, if you lose some weight, if you start to exercise, you'll see the signs and symptoms go away. Now, that takes care of the pancreas as an example. We also want to look at the thyroid, and as I mentioned in class, there's a case study about a girl your all's age that starts to have some issues, and it's about a thyroid issue. But I didn't have you read that just for sake of time this year and to not give you one more thing to worry about. But we'll kind of frame this around that still. So the thyroid's job is to help kind of control your metabolic activity. So it helps to maintain homeostasis in terms of how well your metabolism works. And the thyroid is complicated. It is what we call a complex hormonal cascade pathway. So instead of a simple endocrine pathway or a simple neuroendocrine pathway, this one we call complex because it is. At the end of the day, though, it really isn't that complicated. It's just several simple pathways put together, sort of in sequence. So there's a little more about this on the next slide, but if you look at this picture with me here, you have a stimulus, okay, and in this example, the stimulus is just that it's cold, okay, so you feel cold, whether you're in an air-conditioned room or you're outside and it's cold. And here's what happens when you're cold. A sensory neuron in your brain will recognize that cold, and it will stimulate the hypothalamus. And the hypothalamus is going to release a hormone called thyrotropin-releasing hormone, or TRH. And it will do what it says. It will cause the release of thyrotropin. So that hormone comes down and affects or activates the pituitary gland. And the pituitary will release a hormone called thyroid stimulating hormone, or TSH. Now there's another name for this too, which is thyrotropin. Thyroid stimulating hormone will do what it says. It will stimulate the thyroid. So finally, that hormone goes to the thyroid gland, and it secretes thyroid, or causes the secretion of thyroid hormones, which are T3 and T4. Those then go to a target cell, and if you are cold, they will increase your cellular metabolism, which will actually just generate some heat, right, as a byproduct of respiration, if you remember way back when. So it'll help to warm you up. Now, all of these also have negative feedback, so as they are released, they should kick back and stop the release of the other ones so that you actually have an end point here once you warm up. So, in words again, in this little picture of this guy over here, a stimulus causes a release of TRH from one gland. That hormone causes release of TSH from the next gland, pituitary, and that hormone causes release of thyroid hormones from the thyroid gland. So stimulus starts up here, actually kind of starts here at hypothalamus, stimulates here, stimulates there, and it feeds back also and turns things off. Now, the thyroid hormones are T4, which is called thyroxine, or T3, which is called triiodothyronine. So now you see why they abbreviate them. The primary hormone is T4. That's what usually gets released the most. But when T4 gets to the target tissue, it gets broken into T3 and turned into that. And then both of these can kick back and turn off the thyroid releasing hormone or the thyroid stimulating hormone. So this girl in the case study is having some symptoms, and when the doctor does a blood test, they find low thyroid stimulating hormone, sort of high T4, and really high T3. Here's what's going on. This baffled scientists for a long time is like, why would your thyroid hormones be high if it's not getting stimulated that much, right? You don't have a lot of this thyroid stimulating hormone. Well, it's because of negative feedback, right? The thyroid is releasing too much thyroid hormone in this girl, which means that when we test it in the blood, you're going to see T4, but then T4 is turning into T3, so you're going to see more T3. And because she has all that thyroid hormone, that is doing this negative feedback thing and turning off the pituitary's release of thyroid stimulating hormone. So what she has going on is these cells in her thyroid are just hyperactive, and they themselves are releasing too much T3 and T4 all the time, and so the rest of the body's trying to make up for that, right? It's reducing the TRH that it releases and the TSH that it releases. It's going to reduce those things, but still the thyroid is going to keep making hormone, and it makes her what we call hyperthyroid. So in that little case study, they say that she has Graves' disease, which is one type of what we call hyperthyroidism, too much thyroid. This leads to a hyperactive metabolism. So these people are usually very skinny because they lose weight. They're very jittery and nervous. They tend to be hot and sweaty because of the heat that's being generated in metabolism. They have an increased appetite because they need more sugar to keep metabolism going. They tend to have trouble relaxing and sleeping. They tend to have trouble concentrating because they're so jittery. The heart will usually beat faster, so they have a really high heart rate, and that is going to maintain high blood pressure. Two outward signs, which these are pictures, are two very severe versions of. But one sign is called a goiter, which is where your thyroid is enlarged, so you have this bulge in your neck. And the other one is called exophthalmos, which is a protrusion of the eyes. So this is absolutely scary, and I realize that that's not very common at that kind of level, but the eyes actually kind of bulge out of the head more. Some people look that way naturally. Some people's eyes are a little more forward set, but with hyperthyroidism, you'll see those eyes actually kind of push forward even more, and it's because some tissue develops behind the eyes, deeper in the sockets. Now, you can also have hypothyroidism, too little thyroid, right? And this is where you have underactive metabolism. So maybe if your thyroid is damaged or something like that, it's not producing enough thyroid hormone. These people are the opposite to hyperthyroid, right? They're going to have weight gain. They're going to be feeling very tired and lazy and all the time. They're going to be cold. They're not going to feel like eating. They will also still have trouble concentrating for various reasons, but theirs is more because they're worn out feeling versus being kind of all jittery and nervous. So we talked about epinephrine earlier. It is part of your stress response, and that's kind of how we're going to frame our entire discussion of the nervous system on Monday next week. So this is just being silly, but stress could mean that you get scared because someone jumps out at you in a dark house or something. But it also could mean that you're stressed about a test or something. So I know I never do this to you, right? Where there's only 2 minutes left, let's just rush through everything that matters. But so you get real stressed, right? You're like, oh my gosh, I gotta know this, I gotta know that. What's going on in your body when you have those feelings? What's really happening is a combination of endocrine and nervous responses. And that happens all the time. So every response we've talked about so far actually involves sort of a nervous system component as well. And one of the best understood of those is the stress response that you get that involves epinephrine or adrenaline from your endocrine system and part of your nervous system as well. So epinephrine we talked about a little bit earlier. It's going to have different responses with different tissues, but all of that will lead toward one combined stress response. Now, at the same time, you've got nervous responses that are causing release of neurohormones, and that's mainly the job of the hypothalamus. Now, those neurohormones will also have effects on your body in different areas, and one of those effects is to increase the release of epinephrine. So epinephrine comes from the adrenal glands, again, kind of by your kidneys, but that'll be triggered by your brain sensing the need for it as well. Now, this bottom part, it's kind of hard for me to see, is then a little summary of what your body does, right? If you get scared, let's say that you are, you leave a play that you go to this weekend downtown Louisville, and you're walking down a dark alley, and there's a creepy guy coming towards you. Here's what your body's going to do. You're going to notice that guy. Your nervous system is in charge of your vision, so you see them, you feel that something is just not right, and your body will have a lot of chemical responses that will prepare you to protect yourself, whether that means you fight or you run. And we oftentimes hear this as the fight or flight response. So the body's going to increase blood glucose. Epinephrine will cause your liver to release more sugar, so it's at the ready. You're going to increase breathing rate so that you're ready to work your muscles as well. You're increasing oxygen levels. Right? You're going to increase your heart rate, which is going to get that oxygen out to your tissues. You're going to increase your metabolic rate, which is actually going to keep your cells at the ready. Then you're also going to see the changes in blood flow that we talked about earlier in this PowerPoint. Increase blood flow to your muscles and to your brain. That's going to make it so that you can fight or you can run, and your muscles are ready to perform at their peak. And that blood flow to your brain is going to increase the sugar there, increase the oxygen there, and make you really alert. Your awareness is going to go up, right? You're going to notice things much quicker, and you're going to respond to things much quicker. Now, that is really more of the chemical side to your stress response, and there's some other things going on that are the nervous response as well, and we'll save those for next week. So thanks for listening. I know it's a lot. Continue to try not to get overwhelmed. We're almost to the finish line. So I'll see you guys in class.